Alright, let's talk about something incredibly important happening inside your body right now. Even as you're just sitting there, we're diving into the world of blood, but specifically we're focusing on one of its tiniest, yet most powerful, components. The platelets. You've probably heard of them, especially in the context of cuts and scrapes, but what are they really? Think of platelets or thrombocytes as they're known in the medical world, as your body's on-call emergency response team. They aren't complete cells like your red or white blood cells. Instead, they are small, irregular-shaped fragments that are produced in your bone marrow. These little guys are constantly circulating in your bloodstream, just waiting for a signal that there's trouble. Their main job, and it's a crucial one, is to stop you from bleeding. Imagine you get a paper cut, a minor inconvenience, but one that could be a big problem without platelets. The moment that blood vessel is damaged, it sends out a chemical distress signal. Platelets are the first to arrive on the scene. They rush to the site of the injury and begin to stick to the broken edges of the vessel wall. This initial action is like the first responders securing the perimeter of an accident. They are essentially creating a temporary plug, a quick fix to slow down the bleeding, and buy some time for a more permanent repair to be made by the body. Once they've stuck to the injury site, they don't just sit there. They change their shape, growing sticky, spiky tentacles that help them clump together with other platelets. This process is called aggregation, and it forms what we call a platelet plug. This plug is the body's natural initial plaster, but that's not all they do. As they gather, they release chemical signals that call in more reinforcements, including other platelets and special proteins in your blood called clotting factors. This kicks off a more complex chain reaction known as the coagulation cascade, which ultimately forms a strong, stable fibrin clot. What you see on your skin is a scab. So in essence, platelets are the heroes that prevent you from losing too much blood from everyday injuries. They are the foundation of the entire clotting process, a sophisticated and vital system that protects you constantly. Without them, even the smallest cut could become a major medical event. Their role is a perfect example of how even the smallest components in our bodies play a massive part in keeping us healthy and safe. Understanding how they work and what affects their numbers is fundamental for anyone interested in health and medicine, from students to patients. It's a fascinating look into our internal defense mechanisms. So, we know platelets are crucial, but how many should you actually have? When doctors order a blood test, one of the key things they look at is the platelet count. This tells us the number of platelets in a given volume of blood. The measurement is usually given as the number of platelets per microliter of blood. Now, a microliter is a tiny amount, 1/1,000,000th of a liter, so you can imagine we're talking about some very large numbers here. For a healthy adult, the typical or normal range for a platelet count is generally considered to be between 150,000 and 450,000 platelets per microliter of blood. This range is quite broad, and that's important to remember. It's not a single magic number. What's normal for one person might be slightly different for another, and that's perfectly okay. Think of it like height or weight. There's a wide spectrum of what is considered healthy. A doctor wouldn't be concerned if your count was 160,000, nor would they be worried if it was 440,000. Both fall comfortably within that healthy window. It's when the count starts to dip below 150,000 or climb above 450,000 that we start to pay closer attention, as it could be a sign that something else is going on in the body that needs investigating. This normal range serves as a vital baseline for healthcare professionals. When we see a number, we're not just looking at it in isolation. We're comparing it to this established standard, but also to your own previous results if we have them. A person's normal might consistently be on the lower end of the scale, say around 170,000. For them, a drop to 120,000 would be more significant than for someone who usually sits at 300,000. It's all about context. This is why tracking changes over time can sometimes be more informative than a single one-off reading. It's also worth noting that these numbers are determined by a machine called an automated hematology analyzer. This machine takes a sample of your blood, mixes it with fluids, and then passes it through a laser or an electrical field to count each individual particle. It's an incredibly precise and fast process that gives us a reliable snapshot of what's happening in your circulation. So, when you get that report back with your platelet count, you're looking at a high-tech measurement that provides a fundamental piece of your overall health puzzle, telling us about your body's ability to heal itself. Just like many other things in our bodies, our platelet count isn't static throughout our lives. It changes as we age. Let's start with the very beginning. Newborn babies, believe it or not, often have platelet counts that are a bit on the lower side of the normal adult range or sometimes even slightly below it. This is usually temporary and perfectly normal. Their little bodies are still getting all their systems up and running, including the bone marrow factory, where platelets are made. Within the first few weeks of life, their platelet production ramps up, and their count quickly rises to fall within, and often exceed, the standard adult range. As we move into childhood and adolescence, platelet counts tend to be on the higher end of the spectrum compared to adults. It's not uncommon for a healthy child to have a platelet count that hovers closer to the 300,000 or 400,000 mark. This is just a natural part of their physiology during a period of rapid growth and development. Their bodies are incredibly active, and having a robust supply of platelets makes sense for a stage of life that often involves more bumps, scrapes, and tumbles. This slightly higher baseline is just another one of the fascinating differences between pediatric and adult medicine. Once we reach adulthood, our platelet counts tend to stabilize. For most of our adult lives, our count will likely remain relatively consistent within that 150,000 to 450,000 range, barring any illness or other influencing factors. This is the period where our bodies are in a state of maintenance rather than rapid growth. The production of platelets in the bone marrow and their removal from circulation by the spleen and liver reach a steady equilibrium. This stability is what allows doctors to use that standard range as a reliable reference point for the majority of the adult population. Then, as we enter our senior years, we often see another gentle shift. Studies have shown that there can be a slight gradual decline in the average platelet count in the elderly. The decrease is usually very modest and the count typically remains well within the normal range. This is thought to be related to the natural aging process of the bone marrow, which may become slightly less efficient at producing new platelets over time. It's not usually a cause for concern, but it's an important physiological variation for doctors to keep in mind when interpreting the blood tests of older patients. When we look at blood counts, we often find subtle but consistent differences between the sexes, and platelets are no exception. On average, women tend to have a slightly higher platelet count than men. This isn't a huge difference, and both men and women still fall squarely within the same overall normal range of 150,000 to 450,000 per microliter. However, if you were to analyze the data from thousands of healthy individuals, you would see this clear trend emerge. A man's average might be closer to 250,000, while a woman's average might be nearer to 280,000. Scientists believe this difference is largely due to hormonal influences. Hormones like estrogen, which are present in higher concentrations in women, are thought to have a stimulating effect on the bone marrow cells responsible for producing platelets, known as megakaryocytes. This could lead to a slightly higher rate of platelet production. It's a fascinating example of how our endocrine system, which governs our hormones, can have a direct impact on our hematological system, the system related to our blood. It highlights the intricate connections between all the different systems in our body. Furthermore, a woman's platelet count isn't always static. It can fluctuate throughout her menstrual cycle. Studies have shown that platelet counts can dip slightly during menstruation and then rise during the ovulatory phase of the cycle. Again, these changes are usually small and the count remains within the normal range, but it's a dynamic process. This fluctuation is another piece of evidence pointing towards the strong link between female hormones and platelet regulation. For medical and nursing students, this is a key point to remember when assessing a female patient's blood results. Considering where she is in her cycle can add valuable context. This sex-based difference, while subtle, is a great reminder that normal can vary from group to group. Medicine is moving more and more towards a personalized approach, and understanding these population-level variations is a step in that direction. It's not about treating men and women completely differently, but about being aware of the nuances in their physiology. Acknowledging that a healthy woman might naturally have a higher platelet count than a healthy man helps us to interpret their lab results with greater accuracy and avoid unnecessary concern or investigation. Have you ever wondered what happens to your body when you travel to a place with high altitude like the mountains of Colorado or the Andes? Your body has to make some amazing adjustments to cope with the lower oxygen levels in the air, and one of these changes involves your blood, including your platelets. When you first ascend to a high altitude, your body can experience a temporary increase in platelet count. This is part of an initial rapid response to the environmental stress. The body essentially gets a signal that conditions have changed, and this can trigger a release of platelets that are stored in the spleen. This initial spike is usually short-lived. The more interesting and long-term change happens when you live at a high altitude for an extended period. The chronic exposure to lower oxygen levels, known as hypoxia, sends a continuous signal to your bone marrow to ramp up production of blood cells. You've probably heard that this leads to an increase in red blood cells, which helps your blood carry more oxygen. Well, it turns out that the stimulus also affects platelet production. Over time, people living at high altitudes often show a sustained, modest increase in their baseline platelet count compared to people living at sea level. Why does this happen? The mechanism is complex, but it's linked to the same hormone that drives red blood cell production called erythropoietin, or EPO. This hormone is produced by the kidneys in response to low oxygen. While its main job is to stimulate red blood cell creation, EPO also appears to have a secondary effect on the megakaryocytes, the platelet factories in the bone marrow, encouraging them to produce more platelets as well. It's an efficient system. The body responds to one environmental challenge by boosting multiple components of the blood to compensate. For healthcare students, this is a perfect example of physiological adaptation. It shows how our bodies are not static but are constantly adjusting to the environment around us. When evaluating a patient who lives in a mountainous region or who has recently returned from one, a doctor needs to consider altitude as a possible reason for a slightly elevated platelet count. It's a non-pathological or non-disease-related cause for a variation in lab results. This knowledge prevents misinterpretation and ensures that we understand the full picture of a person's health in the context of where and how they live. Here's something you might not have thought about. The simple act of eating a meal can temporarily change your platelet count. It sounds a bit strange, but it's a well-documented physiological response. Shortly after you eat, particularly after a meal that is rich in fats, your platelet count can show a transient or temporary increase. This isn't a massive jump that would push you into a dangerously high range, but it's a noticeable fluctuation that can be picked up on a blood test. It's one of the reasons why some blood tests, especially those for cholesterol, require you to be fasting. The reason for this post-meal spike is related to how your body processes the food you consume. When you eat, your digestive system gets to work breaking down fats, carbohydrates, and proteins. This process triggers a whole cascade of hormonal and metabolic changes. The absorption of fats into the bloodstream, for example, can make the platelets a little more sticky or reactive for a short period. In response to the overall metabolic activity and the influx of nutrients, the body may also release some of the platelets that are normally held in reserve in the spleen, causing a temporary rise in the number of circulating platelets. This phenomenon is generally short-lived. Within a few hours after the meal, as your body finishes processing the food and your metabolism returns to its baseline state, the platelet count typically goes back down to its normal pre-meal level. The platelets that were released from the spleen return to storage, and the overall count in circulation stabilizes. It's a dynamic ebb and flow that happens every time you eat. This is a great illustration of how our daily activities, even something as routine as lunch, can have a measurable impact on our internal physiology. For anyone in the medical field, this is a practical piece of information. If you see a blood test result with a platelet count that is just slightly above the normal range, one of the first questions you might ask the patient is, when did you last eat? If they just had a large meal an hour before the blood draw, that could easily explain the mild elevation. It helps to differentiate between a normal physiological response and a potential sign of an underlying medical condition. It's another reminder to always consider the context and timing when you're looking at lab values. Now, let's move on to situations where the platelet count is not just a normal variation, but a sign of a problem. When the platelet count falls below the normal range, specifically below 150,000 per microliter, we call this condition thrombocytopenia. A mild drop might not cause any symptoms at all and might only be discovered on a routine blood test. However, as the count gets lower, the risk of bleeding increases significantly. The body's first line of defense against bleeding is weakened, making it harder to form those crucial platelet plugs we talked about earlier. This is when we start to see signs and symptoms. The effects of a low platelet count can range from mild to life-threatening. People with thrombocytopenia might notice that they bruise very easily, sometimes without any memorable injury. They might see tiny, pinprick-sized red or purple spots on their skin, called petechiae, which are essentially tiny bleeds under the skin. Other signs include prolonged bleeding from minor cuts, frequent nosebleeds, or bleeding gums when brushing their teeth. In severe cases where the count drops dangerously low, below 10,000 to 20,000, there is a risk of spontaneous and serious internal bleeding, which is a medical emergency. So, what causes the platelet count to drop so low? There are generally three main reasons. The first is decreased production. The bone marrow simply isn't making enough platelets. This can happen in conditions like leukemia or other bone marrow cancers, certain anemias, viral infections like HIV or hepatitis C, or as a side effect of chemotherapy or radiation therapy. The factory is essentially damaged or suppressed, so the output of new platelets slows to a trickle, leading to a shortage in the bloodstream. The second major cause is increased destruction. In this scenario, the bone marrow is producing platelets just fine, but they are being destroyed or used up in the bloodstream faster than they can be replaced. This is often caused by autoimmune disorders, such as immune thrombocytopenic purpura, or ITP, where the body's own immune system mistakenly attacks and destroys its own platelets. Certain medications and infections can also trigger this destructive process. The third cause is sequestration, where too many platelets get trapped in an enlarged spleen, reducing the number that are free to circulate in the blood. On the flip side, what happens when the platelet count goes too high? When the count climbs above 450,000 per microliter, we call it thrombocytosis or thrombocythemia. Just like with low platelets, a mild elevation might not cause any issues. However, having too many platelets can also be a problem. You might think that more platelets would be great for clotting, but it's a delicate balance. An excessive number of platelets can make the blood stickier than it should be, increasing the risk of forming unnecessary and dangerous blood clots inside the blood vessels. These unwanted clots, known as thrombi, can be very serious. If a clot forms in an artery supplying the brain, it can cause a stroke. If it forms in one of the coronary arteries of the heart, it can lead to a heart attack. Clots can also form in the veins of the legs, deep vein thrombosis, and potentially travel to the lungs, causing a life-threatening pulmonary embolism. While less common, some people with extremely high platelet counts can paradoxically experience bleeding. This is because the massive number of platelets can interfere with the normal clotting process in a complex way. There are two main types of thrombocytosis. The first is called reactive or secondary thrombocytosis, and it's the more common type. In this case, the high platelet count is a reaction to another underlying medical condition. It's the body's response to things like an infection, inflammation, as in rheumatoid arthritis or inflammatory bowel disease, iron deficiency, anemia, or after the spleen has been removed, also known as splenectomy. Once the underlying condition is treated and resolved, the platelet count usually returns to normal. The platelets themselves are normal, there are just too many of them. The second type is called essential or primary thrombocythemia. This is a much rarer condition and is considered a type of chronic blood cancer. In this case, the problem lies within the bone marrow itself. The megakaryocyte cells that produce platelets become abnormal and start producing way too many without any external trigger. This is a more serious long-term condition that requires specific medical management, often with medications designed to lower the platelet count and reduce the risk of clotting. Differentiating between these two types is a crucial diagnostic step for any doctor faced with a high platelet count. We've covered a lot of ground today, so let's quickly recap the most important takeaways about our tiny but mighty platelets. First and foremost, remember their job. They are your body's first responders for any breach in your blood vessels, rushing to the scene to form a plug and kick off the clotting process to stop bleeding. A normal count in an adult typically falls within a wide range, from 150,000 to 450,000 platelets per microliter of blood. This isn't a rigid number but a healthy window, and what's normal can vary from person to person. We've also seen that this normal can be influenced by several natural physiological factors. Age plays a role, with counts often being higher in children and slightly decreasing in the elderly. There's a subtle difference between the sexes, with women on average having slightly higher platelet counts than men, likely due to hormonal influences. Even your environment and daily habits matter. Living at a high altitude can lead to a sustained increase in your platelet count as your body adapts to lower oxygen, and simply eating a meal can cause a temporary, short-lived spike in circulating platelets. Of course, we also discussed when platelet counts signal a problem. A low count, or thrombocytopenia, weakens your ability to clot and increases your risk of bleeding, and can be caused by decreased production, increased destruction, or sequestration of platelets. On the other hand, a high count, or thrombocytosis, can increase the risk of forming dangerous, unwanted blood clots, and can either be a reaction to another illness or a primary bone marrow disorder. Understanding the potential causes behind these abnormal counts is fundamental to diagnosis and treatment in medicine. I hope this has given you a clearer, simpler understanding of the fascinating world of platelets. They are a perfect example of how complex and responsive our bodies truly are. Grasping these concepts, from the normal ranges to the reasons for variation, is a cornerstone for any student in medicine, nursing, or other health sciences. It's this kind of foundational knowledge that helps you build your clinical reasoning skills. If you found this helpful and want to dive deeper into more medical topics explained simply, come check out all the resources we have over at Joen Academy. We're always breaking down complex subjects to help you succeed, stay healthy, and stay curious.